The outstanding questions that we have, though, is it going to be severe to the point where we have trouble with our hospital systems, especially if it's going to be combined with a twin epidemic of COVID-19 in the winter months?
Flu season is fast approaching, and initial observation from the Southern Hemisphere is giving some hints as to what our flu season will look like.
There's been a couple of things that have emerged from the Australian data, and to a certain extent from the South African data, is that flu is definitely back.
Dr. Lagacy Weens is a medical microbiologist at St. Boniface Hospital. He says an earlier start to the flu season in Australia could mean Manitoba will see the brunt of ours before January.
We might get an earlier season than usual, and we might get a season that is much more in keeping with our prior or pre-pandemic influenza season.
With COVID protections easing, Manitobans will be introducing influenza viruses back into their systems, potentially for the first time in 2 years. Lagacy Weens says this highlights a need to get a flu vaccine as soon as they become available.
We haven't had a whole lot of infections with flu over the past 2 years, so we can expect that the population is somewhat more susceptible than it has been prior to this. Vaccines are another way to boost people's immune response, and we are seeing the data from Australia that suggests that there's a pretty good match in the lab between the vaccine strain and the strain that is circulating, or the most common strain that is circulating in Australia.
With a fall wave of COVID looming, we're in untreaded waters. Wastewater data released Thursday for the period of August 28th to September 3rd shows that deaths from COVID compared to last week are down in Manitoba from 10 to 3. But severe outcomes from the virus, including hospitalization and ICU admittance, are both slightly higher. Dr. Lagacy Weens says this is data we should be paying attention to.
Going to give maybe a bit of a stark warning is with kids going back to school in September, the weather cooling down, spending a lot more time indoors, I fully expect that we're going to start seeing an increase in cases in September, but maybe a little bit premature to say we're in it right now.
He expects to see increases reflected in the data within 2 to 4 weeks. In Winnipeg, Mike Albanese, City News.